A healthy young woman walks into surgery for a cosmetic procedure. No chronic illness, no emergencies, no underlying health disease. Hours later, she's gone. Not from anesthesia, not from infection, but because fat that was supposed to enhance her body has entered into her bloodstream, traveled to her lungs, and shut down her ability to breathe. This is the reality of the Brazilian butt lift surgery, a procedure that, despite its popularity, carries one of the highest mortality rates in cosmetic surgery. And today we're going to go beyond surface level explanations, where we break down the exact anatomy, physiology, and surgical risk that makes this procedure so uniquely dangerous. Subscribe to my channel and let's begin immediately. A Brazilian butt lift, or BBL, is a form of fat transfer where fat is harvested through liposuction, typically from the abdomen, the back, the love handles or thighs, processed and then injected into the gluteal region, being the butt, to enhance contour and volume. At face value, it appears safe because what's used is the patient's own tissues, avoiding foreign implants, and achieve natural results. Beautiful, right? Wrong, because beneath that simplicity lies a complex and unforgiving reality. The gluteal region is composed of skin, subcutaneous fats, the gluteal muscles, and critically deep vascular structures. Among these are the superior and inferior gluteal veins. These are large caliber vessels that drain directly into the pelvic venous system and ultimately into the inferior vena cava. What I'm saying basically is that these are heavy blood vessels that carry blood throughout the body. Here's the key issue. These veins are not protected by rigid structures. They are embedded within muscle tissues. So when a surgeon inserts a cannula during fat injection, they are working in a space where slight misdirection or excessive depth can tear these blood vessels. That's how sensitive this procedure is, and once that happens, it changes automatically from a cosmetic procedure to a vascular emergency. When fat is injected correctly, it stays within the subcutaneous tissue, which is the fatty layers after this surface skin. But when it's injected too deeply or under pressure, it can be forced into damaged veins. This introduces fat directly into the venous circulation. At that moment, a condition called Fat Embolism Syndrome has been created because fat enters into torn venous channels within the gluteal muscle, and this fat travels through the inferior vena cava into the right side of the heart. From the heart, it is pumped into the pulmonary arteries, where it becomes logged in smaller vessels within the lungs, causing it to no longer effectively exchange oxygen. This leads to severe hypoxia, increased pulmonary vascular resistance, right heart strain, and rapid cardiovascular compromise. The patient may deteriorate within minutes. Sudden drops in oxygen saturation, tachycardia, hypotension, and altered consciousness, and in severe cases, cardiac arrest. This is why fat embolism is not just a complication, it is a primary cause of death in BBL procedures. Many surgeries involves bleeding, tissue manipulation, but very few procedures involve injecting particulate material into a region where large veins can be directly breached, and that's what makes BBL a very different type of surgery. The risk of BBL is not just surgical, it's anatomical, and the margin for safety is extremely low. A few millimeters too deep, or a slightly incorrect angle, or excessive injection pressure is all it takes for chaos to set in. Over time, surgical bodies have identified key safety principles stating that fats should be injected only into the subcutaneous layer and never into or below the muscle. Why? It's because the subcutaneous layer has significantly fewer large blood vessels, reducing risk of intravascular injection of fat. Now, in a more advanced setting, real-time ultrasound guidance is supposed to be used to ensure the cannula remains in a safe plane. But the uncomfortable truth is these guidelines are not universally followed, and that's why there are lots of casualties today. In some settings, BBL has become a high-volume procedure. Multiple surgeries per day, reduced operative time, and increased pressure on the surgeons. And when speed increases, precision often decreases, causing risk escalation. Because BBL is not a procedure that tolerates shortcuts, it demands time, focus, proper anatomical awareness, and technical discipline. Without these, complication rates rises significantly. One of the biggest problems is how BBL is marketed to young girls. You often hear it's a natural result, safe because it's using your own body fat and is minimally invasive. But these terms can create a false sense of security. Yes, the incisions are small, but internally, large volumes of fat are being removed, tissues are being disrupted, and reinjected into a high-risk anatomical zone. This is not a minor surgery, it's a procedure with systemic implications. There's also psychological component of this surgery. Patients often focus on before and after photos, body image goals, and worst of all, social validation, especially on social media, while underestimating surgical complexity, psychological risk, and post-operative complications. Social media amplifies outcomes but rarely shows these complications. So patients walk into surgery informed about the aesthetics. Certain conditions makes getting a BBL even riskier. First, a high basal mass index or being overweight increases surgical difficulty. Secondly, poor cardiovascular health. Third, there is smoking. Fourth, prolonged operative time. And lastly, large volume of fat transfer. Each of these compounds the baseline risk. Yes, safety has improved over time. Guidelines exist, trainings has improved, and awareness has also increased. But no safety measure completely eliminates the core problem. You are still injecting fat into a region where, if technique fails, it can enter your bloodstream. At its core, the BBL is a risk-benefit equation. The benefit is that it enhances body contour and improve aesthetic appearance, but the risks are a potentially fatal complication that can occur rapidly and unexpectedly. Now, don't get me wrong, a Brazilian butt lift is not inherently evil, but it is inherently dangerous when misunderstood, underestimated, or improperly performed. Because in this procedure, beauty and biology collide in a way that leaves very little room for error. And the truth is, the danger isn't always visible at first. It doesn't always give warnings, and when it happens super fast. So before anyone considers these procedures, they need to move beyond the aesthetics and confront reality, because in the world of BBL surgery, the difference between enhancement and emergency is measured in millimeters. So we've come to the end of this episode. Like and share my content, please. Also subscribe to my channel so that I can grow on YouTube, and I'll see you in my next video. Bye.